Welcome to the Elevating Funeral Service podcast. If you want to run a successful funeral home, cemetery, or pet cremation service, you don't have to be the one that has the lowest price. You do need to be the one that offers the most value, provides the best customer experience, and clearly communicates that in your marketing. On this weekly podcast, Ellery and Welton will show easy ways to demonstrate value to families and create differentiation that helps you stand out from the competition. Hey everyone, welcome to another episode of Elevating Funeral Service Podcast. I'm your host, Ellery Bowker. I'm joined by my good friend and co-host, Welton Hong. And today we have with us Greg Grabowski. Hopefully I pronounced that correctly. And he is a partner at a company called Hospice Advisors. And we've asked Greg on here today to help us learn how to develop relationships with hospice. So what I want to do before we get started is I want to kind of set the stage for why I think this episode and Welton thinks this episode is important. So we obviously know how competitive the funeral business is. It's becoming more competitive every single day, and funeral homeowners are having to fight for calls more and more. They're having to market their services more and more every day. And something that's been, it wasn't there maybe 30 years ago, but it's certainly there now, is hospice. And hospice is sort of the last person or the last people to work with the family. And as we know, in many communities, lots of families are undecided because they're moved to the new area or they're transient, or for whatever reason, they haven't chosen a funeral home prior to that. So with hospice being with that family, naturally there's going to be some recommendations from hospice to the family on what funeral home they suggest they use. There's going to be questions from the family to the hospice person, asking them what they recommend, et cetera. So we obviously know that it's important for funeral homes and hospice to work together. And so what we wanted to do is we wanted to kind of go outside the funeral business and talk to somebody from hospice and get their take on it and listen to them kind of from their point of view. So again, joining us today is Greg Grabowski. Greg, if you don't mind, let's take a few minutes and kind of give the audience a little background of yours, and particularly focus on kind of how you've worked with funeral homes in the past to kind of, build all this together.
Sure. So super quick on my background. I've been at hospice for a very, very long time. I got the hospice bug and have been in the industry for about 25 years, even though I look way younger than that. I started with a large nonprofit hospice that merged with a whole bunch of other nonprofits in Michigan. And then I worked for the National Hospice and Palliative Care Association in Washington, D.C. And then I worked for a large national for-profit provider, Seasons Hospice and Palliative Care, 26 clinical locations across the country at the time. I had two positions at Seasons Hospice and Palliative Care. I was the president of their nonprofit foundation, and then I was also their vice president of communications. And that's where I eventually bumped into at an NFDA convention. Interestingly enough, to Welton's point, before we got on here, we were talking about, how excited are funeral directors to talk to hospice. So this is a pretty interesting, quick story to set the stage. So I was at this foundation and I had this idea of having funeral homes and our hospice locations hook up. So I bought a booth at the NFDA convention. It was in Austin. So that's what, maybe,
that was 2013. That was 2013.
Okay. All right. So you remember? Okay. So I got this booth and I put up there Seasons Hospice and Palliative Care with a map. And then I had the states that we were working in colored, and basically was like, this is hospice. We take care of dying people. You guys do that as well. So I thought I'd have this flood of people in my booth. And so I stood at my booth, and as the people came in the exhibit hall, no one walked over. So then I stepped out into the carpet, shaking hands, saying, "Hey, I'm from hospice." And so on. Sort of people were like, "Hospice? Why are you here? What are you doing? What? And eventually I bumped into the gentleman at the time who was the new CEO for Aurora, Michael Quinn. And Michael was like, since, he wasn't from the funeral industry, he said, "This totally makes sense to me. We got to work together." And that's how I really got started. We eventually took Seasons Hospice and Palliative Care around the country, and we talked to a lot of funeral providers. And that's really where we got in the trenches. And frankly, that's where I really got a good feel for how hospice views funeral directors and how funeral directors view hospice. And there is no doubt there is a chasm of opportunity between those two. So that's, sorry for the long story, but that's how I kind of got embedded in this. And now I'm a partner in Hospice Advisors, which is a consulting firm. And our passion is helping hospices grow. So just like funeral homes are competing, hospices are competing. So, yeah. And thanks for having me. It's been a blast meeting you guys, and looking forward to chatting some more about this.
Absolutely. So I thought what we might do today is kind of cover three things, and we can take a deep dive on any of these three things. But the three things I think that the audience could get the most out of, Greg, would be one, kind of talking about the importance of building that relationship, the need, what's in it for the funeral home, what's in it for hospice, sort of, kind of roundabout there. And then two, sort of the meat and potatoes here, I'd like to talk about some specific tactics that the funeral homes can use to show value to hospice. So not just kind of go and say, hey, pick me, recommend me, but what the funeral home can do to provide value to hospice, so that they become that recommended funeral home in that area.
Sure.
And then three, maybe you could share with us some of the mistakes you've seen, right? Because we all learn from experience, and sometimes it can be very costly. So maybe if you could share some mistakes that our audience can maybe avoid when trying to build the relationships with hospice. And the one thing I want you to make sure that you mention, because it floored me when we talked prior to recording this episode, was the number of deaths in America that hospice is involved with. Oh, yeah. That absolutely floored me. So maybe we'll start with that first question. So Greg, why is it important for funeral homes to proactively try to build a relationship with their local hospice?
Sure. Well, let's just start with what you mentioned. So if you're a funeral director and you're in the business of doing what it is that you all do best, where is there opportunity? So roughly about 1.5 million people last year received hospice care. One of the things that I learned about when I was at Seasons Hospice and Palliative Care, because we had partnered with Aurora Casket Company at the time, was we did a deep dive, and we actually looked at all of our patients that were on service. And what we discovered is roughly half of the patients, when they came onto service, had not chosen or understood, had created any kind of final wishes as it related to funeral, cremation, their funeral services. They had decided none of that. Wow. So, therein lies the numbers. It lies a big opportunity. I think and we can do these kind of things as we go here, but one of the mistakes is, I do think some funeral homes have not ran the numbers. And so in hospice, we run numbers all the time. And I think if you take a look at whether it's your state, your city, getting the numbers together. Dan Funches at the Citadel Group had me run numbers for him one time just in Gaston County, North Carolina. And the interesting piece there was when we broke down the total deaths, there were 2,182 deaths. And of that, about 1,000 of those were taken care of by hospice.
Oh, wow.
And so when we took a look at what were the calls for that funeral home in Gaston, then what was obviously the opportunity to work with hospice? Well, there were 1,000 patients. And if we use my math there, it's simple, 50% of those decided. So that means hospice had 500 patients that were undecided in that county. So I think there's a big opportunity. I think funeral homes do not look at the opportunity. One of the mistakes that both, frankly, hospice and funeral homes have done is tried to help create that, what we call in the healthcare community, the continuum of care. Mm-hmm. And I think it's, funeral homes have an opportunity to view themselves rather as, and don't get me wrong, hospice is a business, hospitals are business, assisted livings are a business, right. But at the same time, everybody in the healthcare community says that they're part of the continuum of care. So much so that even outside of the clinical realm, hospice does bereavement. Those bereavement professionals that are part of hospice see themselves as a continuum of care. So I do think the next logical step is funeral directors need to see themselves as part of the continuum of care. And to your point, that's part of of reaching out. But hospice has done a very good job of pushing forward to their referral sources, which are physicians, hospitals, assisted living, skilled nursing facilities, and so on and so forth. And initially it was relationship building, it was educating, it was helping them understand what hospice was all about. And now it's reached a level of value. Hospice is differentiating what they do to the referral sources so that they can beat out their competitors. And I think the same lesson holds true for the funeral directors. So funeral directors, you need to see yourself as part of the continuum of care. You should use that language. I want to be part of the continuum of care. Clearly, you would love to get referrals from hospice. Hospice would love to get all the referrals from hospitals and so on and so forth, but we use that kind of language to fit into the, system there. I think that's, for starters, is part of the opportunity piece for funeral directors. Clearly, funeral directors have the general consumers. So does this, but I think probably biggest referral opportunities. And the nice part of this is it's professional to professional. Mm-hmm. So, and what I mean by that is that if you look at how hospice operates, patient and family comes to them, chooses that hospice, and right after they're admitted, there's a very small period of time without getting technical, but a clinical hospice social worker sits down with patients and families and does an assessment. And part of that assessment is what kind of arrangements have you made? So right there, they ask the question. 50% of those families we now know roughly are going to say, I don't know. Normally what then happens is the hospice will pull out a piece of paper and they will say, here are the funeral homes in your area. And so you can choose anyone on this list. Now, the interesting thing here is, let's go back upstream. Hospitals do the same thing. You need to use hospice. Here's a list, so on and so forth. Inevitably, what happens though is there's dialogue, right?
Right.
So when somebody says, well, gosh, doc, I don't know any of these hospices, or maybe I've kind of heard, which one would you use, or why would you use this one, and so on and so forth. And so there becomes a dialogue. The medical profession, by law, especially when you look at hospitals, from an antitrust, standpoint, have to offer choice. But when you offer choice, it doesn't mean that you can't dialogue and have an opinion. So it's very, very important that funeral homes eventually get to the right people at hospice, because hospice is going to have those conversations. They're going to say, here's a list. The family's going to say, I'm not sure what to do. And the social worker is going to have this conversation with the family, which is eventually going to articulate into, hey, it sounds like what I'm hearing is you want this kind of service, or you would like these kinds of elements. And I know these funeral homes or this funeral home's really good at it. And you can have choice, but I really think these funeral homes might be able to fit the bill, or this might fit the bill, or we've used this funeral home before, or I've been there before, or I've been part of a service before, so on and so forth. So, sorry for the long answer there, holy mackerel.
No, that's great. It's interesting. So in February, unfortunately, I lost my brother to cancer, and about a week before he died, things progressed super fast at the very end. But about a week before he passed, hospice was getting involved, right? They were going to go out and set a bed up and do all the other stuff. And his nurse at the hospital sent a text message to the hospice lady that we ended up working with and hands me the phone. She sent a text message. The hospice nurse called the nurse, and she hands me the phone. So I'm in my brother's room. I step out. Literally, that handoff was as seamless as could be. She's like, you need hospice? I'm like, okay, I've never met a hospice nurse. Hang on. She said, here you go. And that lady talked us right through it, answered all my questions. And so maybe there was choice, maybe there wasn't. But to me, I think that speaks volumes to the relationship, right, that nurse had with that hospice worker. And that nurse knew that hospice lady was going to take care of us. And as the brother of the patient, it was as seamless as could be. I mean, it was as natural as it could be. So I get what you're saying about kind of swimming upstream. One thing
that's a great example that that hospital then is just so confident in that hospice, or they have a relationship with that hospice, or they might own that hospice, or that's their preferred provider. So they even better. And they did a good job. So yeah.
Yeah. What do you think, just kind of, I'm just a random thought I had, but how do you think the average funeral home views hospice? I mean, do you think they view them as a competitor? Do you think they view them as an ally?
Initially way back when we talk about that Austin, I got a lot of folks that, did not view hospice as an ally. Cremation has continued to, increase since that time. And I think people tie hospice to cremation. You guys would know better the effect related to cremation. All I can tell you is when a nurse or a social worker sits with a hospice patient, they're just trying to help counsel them. They're not trying to push any views. So for funeral directors to say, well, hospice is, part of the cause relationship for cremation to go up is not right. But initially I will say, I don't think funeral homes had an opinion. Some didn't have a really good opinion. Some just were kind of neutral. And I think a large percent of them just weren't quite sure what to make of it. So, but there was definitely some folks that I bumped into, like, I don't like you, I don't like your nurses, and so on and so forth. So, there's always a small polarization, kind of either way.
Could you go back and say what you said about cremation and hospice? Was I hearing you right, that the funeral directors thought that the hospice had something to do with the rise in cremation?
Yeah.
You think did they think they were talking people into cremation?
Correct.
Wow.
Yeah. Early on, when I was doing a lot of speaking.
Crazy.
Oh, absolutely. In fact, it was interesting when we initially put hospice and funeral homes together. I let it organically play out. I just tried to facilitate a little bit. And it was interesting. We'd have Aurora Casket Company. They would invite all of their funeral directors. I invited our hospice people just to have a dialogue. Nice. And eventually we had to actually, before we put everybody in the room, really talk to the funeral home and say, please send the resident who will be positive about this. Our first couple meetings, couple funeral homes sent some older, and I don't mean to stereotype, but they were older male funeral directors. And when they got in the room, they were very grumpy about hospice and very confrontational. And I was like, this is not a good way to start off. Your point, building a relationship with somebody who is potentially an important referral source for you. So we said, let's stop doing that. So yeah. But there was definitely I don't know what the percentage of belief was, but yeah, I definitely think they think that hospice recommends that a lot. Hospice bumps into, because they take care of all kinds of people. They do have people that do not have a lot of economic means. And so they do deal with folks that are indigent. And the interesting thing about, and this just keeps going back, like we keep saying, to hospice's referral sources. So hospitals have indigent patients, and they say to hospice, we need solutions from you related to indigent patients. And so hospice made solutions for indigent patients. Now hospice has got indigent patients, and they say to the funeral industry, we need some resources and ideas related to indigent patients. And so it's not necessarily always cremation, but it's these things kind of flow through this continuum. And so everybody's been very solution oriented to that. Indigent is an issue. So going to your third question, I'll just kind of keep hopping between them. Sure. One of the solutions that we came up for funeral directors is understand that there are indigent patients through the whole continuum of care. And if you want to be part of it, then make some type of resolution and announcement that you're going to be helpful with that. And my solution for a lot of funeral homes is very simple. Print up a couple certificates and present them to hospices and say, you can use this for patients and families for a very basic cremation or a very basic other set of services. Because funeral directors were, well, I can't just open up Pandora and so forth. Well, this is a good solution because you hand your charity and your understanding to the hospice, they can make a decision, and it's not open-ended because there's only X certificates that you put out into the community to some of the hospices. But I mean, that's a good example of, value proposition. The hospitals and the health systems challenge hospice. And so then I think, hospice and funeral directors should, meet there as well. So.
Greg, I have a question for you. So coming from outside in, I'm always about multi-channel marketing. And what I've been seeing funeral directors is now they're spending more and more money on lead generation. But to me, hospice is just totally, it's more or less kind of free, right?
Yeah,
channel
sure.
to build a relationship with. And that's long-term. That really is a long-term lead generation.
Oh,
but
absolutely.
what I'm puzzled here is right now at a current situation, that's a hospice. I think you flash a piece of paper on there. That piece of paper, are they by law? Is there some law they have to hand that off? And then do they have to list all the firms there, or they can just put 3 firms on there? How is that decision made right now?
So that's a great question. So hospice in general, when you start working with nurses and social workers and so on and so forth, they are, from their own professional ethics, especially for social workers, they always want to offer choice.
Yes.
Same thing as
That's great.
everybody else. But there may be funeral antitrust type of laws and things that have to be followed coming up.
Sure.
But I will tell you all the time, hospices do make recommendations. They, just like we talked early on, the idea is we're offering you choice, but let's have a conversation about what would be a really good fit. So a family says, I want to have a big funeral. I want to make sure it's online. I want to make sure we're COVID safe and so on and so forth. And the social worker goes, well, that's a big list of items. And by the way, that matches up really well with this, with this funeral home. So,
interesting.
but well, then, an interesting piece of what a funeral home could do is, so when COVID hit, what did hospice do? It called all their referral sources and said, how can we help? How have things changed? What do we need to do? What are you doing? The interesting thing is when I talked to hospices, I said, did any funeral directors call and offer that? And the answer was no. You guys know Lacey Robinson, who used to work at NFDA. So her and I got together and we looked at funeral home practice related to COVID. And then we did an in-service for hospice social workers because hospice social workers were trying to counsel families about COVID and what should be their expectations about funerals and what questions should be asked to funeral directors. So we got proactive because we're trying to help our hospice clients navigate the funeral industry, and obviously Lacey being part of the funeral industry and me, we partnered together. But it was like, where were guys funeral directors? Call. Let's have a dialogue. Yeah, because everything changed, right? I mean, how many viewings you could do and so on and so forth. And there was some really great innovation out there, which we highlighted, which social workers appreciated, because when they called funeral directors and said, I have a family and so on and so forth, can you do X, Y, and Z? So it's pretty interesting.
Right, because whenever I talk to funeral directors, again, from outside looking in, I always thought that there's some regulation. They always complained, so-and-so hospice already built a relationship with this funeral home and they're biased. So that's always what I heard from them. So I'm like, how come you don't try to build a relationship with them then?
Right. Well, the funny thing is so it happens in the hospice industry. So hospice goes markets to, a hospital and they say, well, we already really love this hospice. They're embedded in here. They've got a nurse here, and they go down this laundry list of things that hospice does. So to your point, hospice doesn't just fold up shop. They go, okay, well, we're going to compete for that business, and we're going to try to ask more value questions and figure out what drives value, and we're going to compete for their business, even though this other hospice has got, a jump on us, so to speak. So, but you're absolutely right. I mean, I think the thing that funeral directors haven't done is talked about their propositions and what they've done differently. And to be honest, listen to hospices when you ask them the question, and then drive real specific things with your group back to them. So, how do you get the body? How do you pick up? How do you do it? And so on and so forth. I can't tell you how many stories from my hospice days when I asked the question, how well did the funeral home pick up? How did you view it? What was your perspective? And so on and so forth. And I got all kinds of stories, both positive and a lot of things that were negative. And then the interesting thing is some of the things that were negative by hospice were a perception. And it was really a funeral director was trying to do the right thing. We talked, last week when we were chatting, a funeral director taking his time, putting on his suit, hair, looking really nice, and a hospice nurse who just rolled out of bed, who's super impatient, needs them to get there. There's a dynamic with the family where we to move quickly, but the funeral director didn't know that. So, something as simple as what's the perception? How do you pick up? And to be honest, I know that there's a lot of funeral homes that sometimes use independent firms and so on and so forth to potentially pick up. So they need to make sure that that's happening really well. So the easiest way is I tell you, a great icebreaker for a funeral home, rather than calling and saying, can I drop off muffins, or can I show you pictures of my new chapel, would be better. How well have we serviced your patients and families? How well have we picked up? Have you attended any services for your patients? Have you felt inclusive? We'd love to build a relationship so that we can do the continuum of care. Yeah, I mean, the other interesting thing is that the other 50% of the patients that hospice talks to, they know which funeral home they're going to, or they know what's going to happen with the disposition of that body, but nobody's pushed forward to say, and there would be no HIPAA violation or anything if a funeral director said, I'd love to have a relationship with you so that we can do a better job with patients and families. And so when you know that we've been chosen, if you could let us know. And hospice could simply ask the family, is it okay that we let the funeral director know?
Yeah.
Because if a funeral director's got to go up 3 flights of stairs and there's all these complications and so on and so forth, and the hospice social worker and nurse can communicate, way better continuum of care. It's way better for the families, so those are these little value things that I think just will help everybody. And hospice is going to be totally receptive to having that conversation, because they're all about wanting to have great care, especially aftercare for the families. It's actually part of the Medicare benefit that hospice provides 13 months of bereavement support for patients and families after for families after the patient has died. So,
one thing you said that just really keeps sticking with me is well, 2 things, but you keep using the term continuum of care, right? And obviously we know what that means, but I think about it from a competitive level. You've got the doctors and the nurses at the hospital, right? And you've got hospice competing so that they refer patients to them. So hospice is trying to show the hospital value, right? And then you're just going downstream a little bit, and the funeral homes are going to do that. And when you were talking about, the funeral home surveying hospice, saying, hey, how have you been treated by us? How have we treated your families? Have you been to a service? It reminds me of the Jerry Maguire movie when Tom Cruise is saying to, I forgot the guy's name, but he said, help me help you.
Right.
Help me help you. So I just, in my mind, I've got thinking about hospice saying to the hospitals, how can we help you? Because you want to be able to pass that family to somebody that's caring and trusting and the continuum of care. So hospice is saying, how can I help you? And then the funeral homes are saying that to the hospice. So I thought that was interesting. Well, Greg, I'm not sure if there's bullet items here you could do, but the other question I had was that are there specific things that a funeral home can do to add value? Right now, one thing I think that we talked about prior to this was being able to have some kind of handouts, right? Some kind of literature, something that the family, that the funeral or the hospice nurse could show to the family, or the social worker could show to that family. That was just one example. But do you have a couple of examples, just little things that funeral homes can do that can add value, just sort of easy wins?
Sure. So obviously we talked in the beginning a little bit on this whole indigent piece. So knowing that there's that kind of opportunity, create some kind of solution, again, within your financial means. I think that's number one. Number two, reach out and ask questions. Funeral directors, your target audience is not the CEO of the hospice. It is the clinical social workers. They do get together as a group. The other target is after hours nurses and nurse case managers who will be with the families, especially when patient is imminently dying. Probably it's going to be one of those nurses that may call you. When they call you, ask, what can we do related to this pickup? I know a lot of funeral directors have some wonderful things they do for veterans and so on and so forth. Share that with the hospice that you have those programs. As it relates to veterans, most hospices have special programs related to veteran. It's called We Honor Veterans. So that is one way for you to tap into a volunteer program that hospice had called We Honor Veterans. So that's another point. When you are doing your social media, which is what Welton's all about, as a funeral, think about what it is that you're an expert about. You're selling your expertise to hospice. Hospice sells its expertise to referral sources. Hospice sells its differentiators to referral sources. That's what you should be talking about with hospice. So the interesting thing is hospice employs a lot of social workers. These social workers need to be experts in all of the resources in the community, and they need to be experts about end of life, Medicare, insurance, and so on and so forth. A lot of hospice social workers are trained by hospice about hospice. A lot of them are potentially, clearly there's veterans, but not every hospice social worker knows all of the funeral benefits, all the ins and outs at the state, all the ins and outs locally, and so on and so forth. So if I'm a social worker, I need to know everything about end-of-life care, including funeral services. And so can a funeral home get online and say, hey, I'm doing a seminar for social workers about all of the intricate ins and outs that you should know when you're talking to families, because I know you guys are talking to about 50% who are undecided about certain elements of funerals. So I'm going to go through those. Have a seminar at your funeral home. Have them meet your staff. These are the folks that do the pickup. These are the folks that work here. This is the outreach director. This is my funeral director, who also is a licensed bereavement and or has gone through a lot of that, or is a licensed spiritual counselor, and so on and so forth. Those things match up. Bereavement, spiritual counseling, those things all meet really well. So hospice has, as part of their group, has a nurse, a social worker, potentially a volunteer, and spiritual care coordinator, and a hospice aide. So spirituality, the celebration of life, celebrating a legacy, those things all come out potentially with hospice and certainly come out with funeral homes. There absolutely can be a lot of cross collaboration related to that. Now, there are opportunities, if you know that those things are important to a hospice, bring in a guest speaker that would be hot. What is hospice doing with COVID right now related to, funeral and hospice? And bring in a guest speaker, because it will draw in those hospice professionals. Continuing education credits are hard to get, but they're not impossible. You find the right kind of social work session that you could sponsor for hospice with continuing education credits, even more. Social media wise, again, for Welton, I would say funeral directors hook up with hospice, the people I'm talking about, on LinkedIn. Introduce yourself and say to them, I would love to have a conversation with you on how we can better be part of the continuum of care and bring value. And I'd love to just meet you to build the fundamental relationship, but take it to the next level and do some of the things that, that we talked about. That's probably pretty good for a starter. I think the other thing you can do is, if you are so inclined and you have somebody who can facilitate a really good meeting, is to see if you can find out all the different things of how your local hospices view you, and then begin to strategize ideas around how you eat those value propositions. Everybody's got something that's potentially a little bit different in different communities. So I don't want to say it's one size fits all. Another example is, part of hospice is that they must have volunteers as part of the care. And when I worked in hospice, we partnered up with everybody in the community, including funeral homes, to collect up used flowers. So after a service, before those flowers got tossed, pulled them all out, put them in big bundles. A volunteer from hospice drove around to funeral homes, grocery stores, other places where there were used flowers, put them all together. Volunteers chopped them all up and took them to assisted livings, nursing homes, hospice patients at their homes to brighten the day, to the hospitals, and so on and so forth. And there was always a little card with it that said, to brighten your day, and an acknowledgement that the funeral home, the grocery store, the flower shop, we're all part of this, what we called Flower in the time, called Flower and Power. And so, it became a very big, successful item that happened out in the community. And then, of course, nowadays, that was a while back. Nowadays, that would then get touted out on social media, right? So the funeral director could say, I'm part of Flower and Power, and here's what I'm doing. The funeral director could actually be part of the volunteer, component, there. So I think that's a wonderful thing to tap into. Hospices, as I said earlier, 13 months of bereavement care. Why not offer the hospice? A lot of hospices don't necessarily have office space, or they got a lot going on. Would you like to do your bereavement counseling groups here at my funeral home, or at my chapel, or our hall area? And as a matter of fact, again, I've got somebody who has a lot of grief background, and they could potentially co-facilitate with you. And in fact, we could invite, most hospices are happy to invite anybody in the community. So now you may have some aftercare maybe happening with your funeral home folks that did not utilize hospice, and you could put them all into one kind of big or whatever size group that you want to do. So their opportunity to make that connection there as well.
Got it. Greg, I have a question for you. The hospice industry, let's say your local hospice, are they active on social media much at all, or typically they're not that active, or varies, of course?
Sure, and it's a great question. So the industry is still relatively young. It started in the 70s and 80s. And so this current statistic is about 62% of the hospices have 50 or less patients. And so they are trying to market, so they're not as sophisticated. But every larger hospice, and there are large national hospices, yes, they're very active on social media, very active in their electronic outreach. The reason why we probably haven't seen it is because if they're really savvy, they are pushing all that information to referral sources.
I see. Okay.
Yeah. Yeah. Because as we know, the general public's not super excited about talking about death. So that's why you don't see a lot of hospice billboards. People don't drive along and go, oh, my mom's not feeling so good. That's going to be the hospice I choose.
Yeah.
So hospice has learned for them, you need to be talking to doctors, case managers, hospitalists, administrators of nursing homes, social workers in nursing homes, executive directors of assisted livings, personal care companies. That's where you need to be talking, because when somebody really understands, unfortunately, that they're dying, they usually do it, and it was prompted by a trusted healthcare resource. So the doctor says, unfortunately, your mom's not doing so well. We need to go in and talk to her, but it's time for hospice. And so, just like your example that you had there, Ellery, it's the same thing. Then you go, yeah, you're right. And then hospice appears and they're there. So you don't see a lot of online marketing or those kinds of things that are directly to the consumer. But there is quite a bit where hospice is doing the same thing that I just suggested, which is we're an expert to doctors. And so, how do you look at pain management related to these things clinically, or how do you have the compassionate, conversation, with a patient, and those things.
Greg, how do hospices make money?
Probably 99%, I don't know the exact statistic, but about 99% of the care is paid through Medicare. So okay. Medicare, some states have, Medicaid or state aid. So there is a hospice benefit related to both of those. The interesting thing about hospice is it's a per diem. So they get paid per day for taking care of a patient. So if you think about it, hospice and their reimbursement is not massive. In fact, it pales in comparison to what a hospital and or a nursing home does. So hospice does a lot with a lot less. But everything that happens with a hospice, once somebody signs on to wanting to use their hospice benefit, especially as it relates to Medicare, then basically they shift from their Medicare benefit as they know it, and they sign on to hospice. Hospice gets that per diem and takes care of their pharmacy, takes care of doctor oversight, the nurse, the social worker, the DME, the bed that gets home, the medical supplies, all of those that relates to the care of that patient now is covered by hospice directly, and hospice gets the per diem. And the reason why hospice is frankly held in great esteem for numbers of different reasons. We talked a lot about a lot of heart share, but from a business perspective, hospice saves the whole healthcare system millions and millions and millions of dollars, because patients are not going through that futile care and they're not dying in the intensive care units,
right?
Which is good. People get to die at home. Small amount use private insurance, but the majority of folks are doing they're on Medicare. That's the older population that is utilizing hospice.
So Greg, I have a final question, and again, thank you so much for your generosity, your time. I've learned a ton listening to you before and tonight. So let's just ask this: 0 to 1. I'm a funeral home. I have no relationship with hospice whatsoever. What's the first thing I should do?
Is reach out to the hospice and say, how can we help, especially now related to COVID? What can we do to help you? And what do you need to know about us that will help you with patients and families? I saw this crazy guy say we should be part of the Continuum of Care. I get it. That's what I'd like to do. Start the dialogue from there. And then if you need help and you're so predisposed, talk to us here, or, talk to us, and, we can certainly help you be more sophisticated if you like. But in general, that's how you should get it started, in my opinion.
And Greg, how can our listeners get up with you? I'm sure you're open to LinkedIn requests and all the other stuff, but how should someone get up with you?
Sure. Obviously, my partner and I are both on LinkedIn, Greg Grabowski and Kurt Kazanowski. So 2 skis, which by the way stands for skills, knowledge, and intelligence. You can hit us on LinkedIn, but you can also just go to our website, which is hospiceadvisors.com. And you can fill out a little inquiry, and we're happy to get back with you that way as well. So.
Awesome. Well, again, Greg, thanks so much for your time. To the listeners, we appreciate you tuning in. If you found value out of this episode, we would ask you to go to your favorite podcast app and leave us a review. It helps us get found by more funeral home owners. So we'd appreciate you doing that. If there's anything that Welton and I can help you with or any suggestions, please reach out to us, which, by the way, is one of the reasons why we're doing this episode on hospice right now, is because we had a listener reach out to us and ask this very question, which is, hey, how can I build relationships with hospice in my town? So thank you for that. That's great. Well, we'll talk to everybody soon. Thanks so much, Greg. Thanks, Welton.
Thanks.